In the Greater Shepparton area, there is 281 active cases of people with COVID-19. There's 31 new cases in the last 24 hours. Across our local public health unit, there's 490 active cases. So our local public health unit goes as far down as Wallen and Kilmore and across to Mansfield, up to Cobram and back down the highway to Kilmore and Wallen. In relation to GV Health, there's 11 patients in hospital with COVID at the moment. 4 of those people are in intensive care and 3 of those people are on a ventilator. So we're seeing still a number of people coming in requiring care in hospital, and of course people can deteriorate pretty quickly. That's still what we're seeing in relation to the Delta variant. It does, people can appear to be well for quite a period of time, and then they can quite quickly go downhill. So to anyone who is at home with COVID, currently an active case, if you are noticing a little bit different, you take the steps that the teams that have been providing care and services for you while you're in home, take their advice, and of course call 000 if you're really worried about your health. In terms of keeping on top of things as we go forward, what we're really always encouraging people to do is to get tested straight away as soon as you get any symptoms of COVID-19. So that's a really important thing, and it will continue to be a really important thing for us in the months to come. So that early warning signs in terms of the mild cold and flu symptoms, loss of sense of smell, really want people to come forward and get tested as soon as you notice anything different in that regard. From a vaccination point of view, so the numbers that I'll refer to were those that were available on Monday, so are wrapped up as of the midnight Sunday just gone. Really pleasingly for Greater Shepparton, this of course is the second week now that we've been above 95% of people who have had a first dose. As of last Sunday, there was 79% of people who had a second dose. So by now, those numbers, as the days have gone by during the course of this week, I think we should be now have hit the 80% double dose mark for the Greater Shepparton local government area, which is a terrific result. Our local public health unit again is responsible for the vaccination program for the state-based hubs and spoke sites around our region. So I'd like to thank all of the staff at our vaccination sites and at our partner health services across the region, because the same numbers are apparent in other parts of the Goulburn Valley and Northern Victoria area, in the sense that over 95% of people have had a first dose, and it will be over 80% by now have had a second dose, which is really terrific. Around about at the beginning of October, around the 8th of October I think it was, we launched the Get the Jab Done campaign. That was based on the data that we had at that stage that showed us we were really concentrating and focusing on our efforts of having 5,000 people come forward for their first dose of a COVID vaccination. So we knew at that stage we were getting down to the last remaining number of people who hadn't booked an appointment, and really pleasingly I can report today that we'd be in the order of around 300 people out of that 5,000 people who were asking to come forward and get the jab done. So to all of those people, and to everybody else in fact who's been vaccinated for COVID-19, we really thank you for doing that. We know it's the best way to protect ourselves and protect our community and your loved ones from getting COVID and ending up becoming quite unwell. So to everyone who's got the jab done, thank you and well done, we really appreciate it. In terms of the booster doses, people will have seen the announcements yesterday by the Australian government. So pleasingly, the Therapeutic Goods Administration has provided some advice in relation to booster doses, and we're expecting some further advice now from the Victorian Department of Health once the Australian Technical Advisory Group on Immunisation provide their clarity in terms of booster doses. So with all of those things needing to just run their course in the coming couple of days, We expect as soon as, it will take 2 or 3 days for that information to become clear, but as soon as we have that information, we'll share it with everyone publicly about how they can access a booster dose. So a booster dose, though, I would say is different to a third dose. So a third dose of a COVID vaccine is for people who have particular health conditions, such as being immunocompromised or other chronic and complex needs that are receiving a third dose, which, as I said, is different to a booster dose. So the booster doses are really going to be targeted at mainly high-risk people in terms of healthcare staff, border control staff, those really high priority groups that were part of the first stage of the vaccine rollout earlier this year. So really, thanks again to everyone who's come along and been vaccinated. It is really important that if you hold those second dose appointments if you haven't quite got there yet, and I'm sure that next week we'll be well and truly into the early 80% or hopefully in the mid 80% for second dose vaccinations as well. So I'll take any questions and then hand to Kim.
Were you expecting this response to the Get the Jab Done campaign?
We were really thrilled with the response to Get the Jab Done. I think people really resonated with it. It's a simple message and one that's pretty easily understood. And we know that at that stage we were coming off the tail of that outbreak in August and September, and we've moved pretty quickly at somewhat of a steady state, I guess, in recent weeks. So it's been terrific to see people take up or respond to that call and come and have their Get the Jab Done campaign. It's been really pleasing to work with the Greater Shepparton City Council on that effort. It has been a partnership, and we've worked pretty closely with some local media companies as well. So again, another terrific example of people in the Greater Shepparton area really getting behind the COVID response. This one's a little bit different, I guess, in terms of vaccination, but it's been terrific.
And with Melburnians coming to Shepparton from tomorrow, what can we expect? Is the health service prepared?
Yes, our plans remain in place. Have had plans in place for a number of months, ever since the pandemic began. In terms of people coming from other parts or metropolitan areas, it's not, I don't think, going to have a significant impact any other time than it would, say, for a normal long weekend if we didn't have COVID. So our services are ready to respond to, say, increasing numbers of people attending to the emergency department and the like, but I don't think it'll have a significant impact on our COVID-related services. Yeah.
What's the message to people ahead of the weekend with Melburnians coming up and freedom of movement? What is that message?
So again, the simple things we can do will always remain into the future, particularly in the smaller confined spaces of trying to keep and maintain distance, safe distance from everybody, particularly when you're unable to wear a mask. So that's obviously, of course, when people are eating or drinking. So please, it's all of these little things that I've touched on previously, is that always check into the venues, use the QR codes, help the retailers and the people in the hospitality sector, because they're just trying to do their job as well. But those things about checking in, sanitising, keeping your distance, but definitely wearing masks, particularly when you're indoors and outdoors, of course, but particularly indoors, is really important to reduce the chance of any transmission. Yeah.
And we get the home PCR, the home testing kits are coming shortly. What should people expect from those? How widely available do you think they'll be?
I understand. Excuse me. I understand the rapid antigen tests will be commercially available in the not too distant future. That will be, I believe, in supermarkets and pharmacies and other areas as well. So I think, from my point of view, anything that's going to give us early information about people in terms of if they are going to test positive, or they're in terms of helping them get to the point of getting a diagnosis that they are COVID positive, that's absolutely a great thing. So I think that's a really important moment as well at this stage, as we're starting to transition and get used to COVID being with us certainly for the next few months. And on that note, people testing themselves with rapid antigen tests is good, because we've all got to take responsibility for COVID and being in our community and how we keep ourselves safe and the broader community safe. Rapid antigen tests are an important part of that.
So hello everyone. So it's been a really busy time, but really proud of our community, how we have stepped up and had the jab and supported each other through that period of time, and convincing and encouraging each other around the importance of doing so. The testing sites are busy again, so please be a little bit patient there if you have to wait. Take a drink, make sure you've got some food. I mean, it's not extraordinary long periods of time, but I have heard up to an hour and a half, so and sometimes much shorter. So yeah, just be aware of that. Also, we have a team on the ground that are assisting businesses in regard to making sure their premises are compliant. They're not there to point the finger, they're there to support, so please reach out. You can get the information on the council website or call council if you need that support. It's actually been a really great opportunity to work together with businesses, and as we said, the on the ground team that are really helping assist businesses that still have maybe some confusion around if they are doing everything that they need to be doing to be making sure our community is safe. So that's important. Also food relief, we're still getting some people contacting council, contacting me in regard to needing some support when they are in isolation. So please reach out. Again, you can call council, you can also get on our website. But yeah, we need to make sure that people are being supported. There's still a slight gap in vaccinations, so let's try and close that gap. We are now seeing the light at the end of the tunnel. We're all looking forward to getting back to having our friends and families. I'm looking forward to seeing my daughter in Melbourne very soon. So it's just a matter now that we just, as we say, close the gap with the vaccinations. We know that's the roadmap out, but looking forward to getting back to the things that we love doing. We've got some events coming up. We've got some wonderful opportunities to, really celebrate the wonderful and amazing job we have done as a community during this very challenging time. So let's really looking forward to seeing everybody, and hopefully not too far away, getting our lives, really back on track. Please support the local businesses. Finally, that's so important. I've talked about it a lot. They've really struggled, as we know, but coming into Christmas, what a better time to spend the dollars that we're going to spend locally. It will keep people in jobs. It'll make a difference. So please do that. And I look forward to seeing you all really soon.